Thank you, Joan, for the opportunity to come and share LifeSpan's story and to bring some light to this very real crisis that we're looking to address as a company. And that's the crisis of burnout in healthcare, frontline healthcare workers, doctors, nurses. So a little bit about myself. I've been in technology now for 47 years. I started out when big mainframes were in rooms, and I've been in financial services for these 46, 47 years. A couple of years ago, I kind of had an epiphany and said, you know, what now? What's left for me? And am I really doing a societal good? And so, you know, I'm a social impact person. And you know, 2 years ago, I'm sitting there and I was, you know, building out some systems to deliver. And I said, you know, what am I doing that's going to benefit somebody? I'm just impacting the financial services or the bank's bottom line. And it's really not helping the quality of life for anyone. And so I retired and I looked for a huge problem to solve. And I stumbled across the University of Arizona and technology coming out of research, out of the office of, out of the lab of Samuel Keim, who's the chief of emergency medicine at UA Banner. So I looked at it and said, this looks like something, but I had no idea, you know, about the use case. And so I started researching, and the more that I researched, the more that I knew, that I came to realize that there's a huge problem here. And those very people that I call to heal me, save me, they need healing too. Sometimes even more than we do. And so I solicited them, I licensed the technology and started to build a platform. But I still didn't have an appreciation, a full appreciation or understanding of what our frontline workers go through on a day-to-day basis until this. Do you know that picture? It's a series, you know, right? And you saw that episode. He's melting down. He's that chief in emergency medicine, and he lost it. These people are called on to deliver in the face of all odds, whether it's shortages, whether the equipment's working, whether they are having a meltdown. They just need to get over it and deliver. But you have to realize that they are human too. And I asked our chief, is this show realistic? And he said, it's about as realistic as you can get. But the things in a real emergency room go at an accelerated pace of what you see on that television show. The difference there is these actors go to commercial break. In real life, there's no commercial break. The reality is, what we're faced with is 50% of all physicians and nurses suffer from, I won't say suffer from, but meet the clinical definition of burnout. And in emergency medicine, it's 63%. And I was really surprised to find out that veterinary medicine has the same type of burnout rate as emergency medicine, over 60%. And it places a financial, not only an individual burden, where there's 300 to 400 physician deaths a year, but it's also, you know, they leave the practice that they've worked so hard to be a part of. But in addition to that, there are societal costs as well as costs to the patient, medical errors, financial burdens. It costs $500,000 to $1 million for an institution to replace that physician once they leave the practice. There's a lot of contributing factors. They come at the system level, at the healthcare level for the providers, as well as the patient. there's more errors, there's lower quality of care. For the providers, there's the depression, and as I said, 300 to 400 suicides a year from physicians, substance abuse, and poor physical health. At the systems level, there's high turnover rate causing them to be able to have to pay $1 million to get a new physician. And it's costing the healthcare system all total over $4 billion a year in cost because of burnout. Yet with all of that data and published reports all over, the gold standard remains observation. It remains surveys, self-reporting, assessments. And that's like, and healthcare systems are losing a valuable opportunity to get in front of it, to get valuable insights before the symptomology starts. I call it closing the barn door after the animals got out. But we at LifeSpan believe that burnout is predictable and therefore is preventable. We're building a transformative framework that combines predictive analytics and behavioral data so that we can get the insights that we need before symptomology starts, before they have to leave the practice, before the stigma starts that I'm not doing my job. And so why now? It's because it needs to happen, and we need to change the culture in healthcare. And it's a trust factor. People focus on burnout, but burnout is only a result of an even larger problem, and that's called moral injury. So we have to go bottom up at the individual level to build resilience, and we have to come top down at the system or institutional level so that we can change and transform the culture and bring those system level insights so that the physicians that depend on those institutions to take care of them, they can regain that trust factor once again. So as I said, we're building Empower Plus. And Empower Plus is a digital platform that has an integrated set of tools that has wearable data. It connects to wearable devices. It incorporates self-assessment data as well as surveys. We also have an integrated peer support and coaching network because one biomarker of oncoming burnout is digression from social activities. So we monitor the biometrics, that's passive. We monitor the social aspects of engagement data. We look at the self-assessments, and we combine all of those things to come out with a risk score. Understand, we're not diagnostic, but we are showing you, we are predicting that you're trending towards it, and we make recommendations on interventions and things that you can do. We also have micro-learnings embedded in the platform, and we do those things both for the resident physicians who we're dealing with right now in a mobile application, and we also deliver it at a web browser or web-based portal at a systems level so that it has de-identified aggregated data, but those program directors that's taking care of those cohorts can look at things at a systems level and a population level so that they can see where the hot spots are and where they can pay attention so that they can better serve and support those resident physicians. So we've been very, very fortunate in our time, and we have some great partners. We've just come out of IRB with New York Presbyterian, and we're looking to kick off the pilot with them. We're in pilot right now with Northwestern University and collecting some good data. And what I'm really excited about is our go-to-market opportunity with Andrew Weil Center for Integrative Medicine, where we're going to be looking at a joint development, co-branding, co-distribution arrangement where they'll integrate their data and their content with our platform and deliver it to their subscriber base. And I'm really fortunate about these guys. They're smarter than I am. I really depend on them, and they're committed. through all of it, they're committed and they're very seasoned. Collectively, we bring over 150 years of collective relevant experience. And so they're really working to move this thing out, and I can't depend on them enough. So where we're going, right now, we're crawling, walking, running, flying. So right now we're crawling. We're doing things at a program level where we're looking at individual residency programs, but we're looking at scaling and moving this to a systems level. And once we do that, now we're looking at other verticals that we can go into, air traffic control and some of the others. And right now we're looking at radiologic technicians. We were just contacted by someone yesterday that says, look at radiologic technicians because they have a very high burnout rate similar to emergency medicine. So we're meeting with them tomorrow to see how we can partner to go to market. So that's where we are. If there's anyone, that wants to partner or wants more information about what we're doing, please contact me, and I'll be very, very happy and honored to work with you. Thank you.